Vitamin D has been in the news a lot, especially the past 10 years or 10 to 15 years since the Vitamin D Council said that most Americans are deficient in vitamin D. And it is, I don't know if that's most Americans, but there are a large proportion of Americans that don't have enough vitamin D. And vitamin D is really important because it's important for bone health. A lot of people know that, but it's really important for immune system health. That's why I really recommend throughout the year, especially during the winter months, that patients increase their level of or intake of vitamin D. But what I'm seeing lately is looking at blood tests and blood work from patients is that people's vitamin D levels are too high. I'm not saying this everyone's, but I'm starting to see patients, so they're getting dangerously high actually. 120s, 130s, and if you look at a blood test, we want it around 35, 40, 50 levels as far as vitamin D in our blood. So we're starting to see too high levels, and that can be dangerous because one of the biggest things is it can cause calcium buildup in our arteries, and it also can cause bone mineral density problems decreasing, like bone mineral loss, osteoporosis, osteopenia, and things like that. So things that vitamin D is supposed to help with us, if it gets too high, it can actually go the other way and hurt us. So the tip for the day is just if you're taking a bunch of vitamin D, so if you're taking D in and of itself, but then you're also maybe taking a multivitamin or other vitamins that have D in it already, you could be getting 2, 3, 4,000 units of vitamin D a day in. So look at your vitamin D levels. And in fact, if you don't know your vitamin D levels, you need to get them checked. It's that important to get them checked. And this is from a blood draw. If you're a patient of mine, you want to get it checked, we can order that for you. I can give you a LabCorp slip, and it's a simple test. You go down and get it tested. If not, go to your family doctor and tell them to include a vitamin D level test at your next visit or at your next blood work visits, because it's that important to know. Because when you know, then you know if you need to supplement more, or if you're taking too much and you need to back down on the supplementation. So in the summer months, usually I don't recommend that many people, my patients, taking vitamin D, extra vitamin D, because if you're out in the sun, we're getting natural sources of vitamin D. So we get usually plenty during the summer months. It's when it gets to Halloween and fall, and then in the winter time, we're just not outside as much. That's when we usually need to supplement. Plus, it's very important for our immune system during that time of year. But again, if you don't know your vitamin D levels, you should. It's an important biomarker to know how your body is doing and how much you need to supplement, or if you even need to supplement at all. I'm just seeing a lot of people are just taking D, and they don't know their levels, but they're getting too high, and we don't want that. So get them checked, and leave comments if you have any information on that, or you comment on your vitamin D level. And if you're a patient of mine, you want to get it checked next time in your office, or you're in the office, or call us up, and we can get that ordered for you as well. So hopefully this helps. Everyone have a great day.